Hi everyone. My name is Fiona Lewis, and I'm the patient support liaison for AMAC. And I'm pleased to welcome you to this webinar today. AMAC is a leading funder of research into bone marrow failure diseases in Canada and supports patients and caregivers across the country who are living with aplastic anemia, myelodysplastic syndromes, and PNH. We host monthly Zoom patient support meetings, which are open to patients and their family members. And we also host in-person patient education events during the year, many of which are live streamed via Zoom, so people can join from home. So please check our website if you'd like to register for any of these meetings and also to access the many other resources we have there. We will mute your line during the presentation today, but you can type any questions you have into the chat, which you can see just by hovering your mouse over the bottom of the screen. Um, we may address your question at the time if it's about a particular slide, or else we'll wait till the end and go through the questions then. Please note that today's webinar will be recorded and posted on our website probably next week. So I'm pleased to introduce Bonnie Wooten to present today's webinar entitled Your Health, Your Voice, Making Care Decisions That Fit Your Life. Bonnie is a registered nurse and shared decision-making implementation consultant / decision coach with the London Health Science Centre. Bonnie's work is focused on enhancing quality of care and improving patient and family-centered care. As the shared decision-making decision coach at London Health Science Centre, Bonnie facilitates access to evidence-based information, clarifies decisions, monitors patient needs, and develops the patient's skills in understanding their options. Recently, Bonnie was the recipient of the 2026 Children's Miracle Network Hospitals Impact Award for Canada for her outstanding leadership in advancing care that puts families at the center of important health decisions. So, welcome, Bonnie. And with that, I'll turn it over to you to begin the webinar.
Thank you very much, Fiona, and welcome everyone. I'm hoping everyone can hear me all right. And Fiona's going to assist me by navigating the slides. And I'm very pleased to be participate in this webinar this evening. And it's evening for me. It's daytime it's 3 o'clock for you. I am in London, Ontario. So thank you for joining. We can have the next slide, Fiona. And just to give you a general sense of what shared decision making is, it is a tailored support structured program, and it provides clear resources and support to families, patients like yourself when they need to retain control during life-changing decisions. Because I feel very strongly that a well-informed family or patient is an empowered one, and an empowered one is a key to a healthier future. So we'll go on, and I'll talk a little bit more about what shared decision making is. If I can have the next slide. It is, as I mentioned in the first slide, it is a structured process to support decision making between you and your healthcare provider. It's a conversation in which patients and caregivers work together to figure out how to improve a problematic situation. Shared decision making is a method of care. So when you see SDM, it's shared decision making. Sometimes on the slides it will show that, but the written word is it's a shared decision making is a method of care. And there are 3 steps in this method of care. It's the choice awareness, because there's a decision to be made. There are options. You discuss options, risks, the benefits, the pros and cons of those options, and values. Values are very key of what matters most to the family and child, or to you as a patient. So these steps apply no matter whether it's pediatrics or whether it's adults. So choice awareness, looking at options, and how you value those choices and options. The bottom line is the right decision isn't the same for everyone. And this is especially relevant when more than one reasonable path exists. Next slide, please. And just keep clicking a bit because this one comes in, Fiona. It's about unhurried conversations. This is the conditions for care that fits. Look at the undesirable situation, improve the situation. That's what the conversation is about. Next slide. As a method of care, the conversation, we have to figure out what's going on. We have to focus on the experience and its problems. We have to have a conversational inquiry with you as a patient. And we look at just weighing and negotiating and problem solving, looking at some insight development of what's happened to you, what the issues are for you, what you've experienced, and try to plan a well-developed approach with reasons that make sense and what would indicate that there is a plan that we can work through and do something about. That's kind of what the method of care is about as well. So it is about working together. It's about a conversation. And the next slide is about the information exchange. It's a process that we exchange information. There's decisions to be made. We find out what you as a patient are experiencing, what your values and preferences are, and then we try to work together on the best available evidence and what your values and preferences are. So that those are kind of the links with shared decision making. It is an approach that we try to work together with the patient and the healthcare team. It's about a conversation and it's about an information exchange process. Next slide. And the key points here is the goal of shared decision making is not to get people to follow a recommended care plan, but is to form a plan for you that makes sense to you. Sometimes people, medical care teams look at care plans that are similar to everyone, even if you have the same diagnosis. But the goal for shared decision making is not to follow a recommended plan, but to form a plan that makes sense to you. And it's a method of care that's based on, as we've already talked about, conversations that amplifies. Oh, don't, no, come back to that slide, please. Come back. No, come back. Go back. Thank you. It is about conversations that amplify the ability of clinicians and patients to change problematic situations. And it's not more than, it is not more one more thing busy for clinicians to do. It is part of how they make things better for their patients. So when they say it takes time, it doesn't take time. It is part of what they do to make things better for their patients. And it's to enable shared decision making. The conditions favorable to care are needed. Okay, the next slide, please. So what I'm going to talk with you about now in the next slides that are coming is decision guides that I use as a decision coach, question prompts, decision coaching itself, and patient decision aids. So I'll go through those and explain what they are. If I could have the next slide. This is what I call a decision guide. It's very well known. It's found on, you can Google it, to the um, Ottawa Institute and look for Ottawa's personal decision guide. And this is a guide that really, it's a tool. It's a validated tool. It talks about clarifying the decisions, identifying what is your decision that you're trying to resolve. Do you have a time frame that you have to make this decision by? What else have you already? Are you partway through thinking about it? Have you chose a decision? Or are you still undecided? And then as you go through the guide, it gives you 3 options here. You could have 4 options if you want. As a chart, it goes through, provides opportunity for three options. And you identify in option one. Option one could be what the physician is recommending for you. And you identify what the pros and cons. As a decision coach, I identify what the pros and cons are of that particular recommendation. And then here you choose on a scale of 1 to 5 how much you value that, with 5 being the most important. How important is this option for you? And then the second option could be I don't, that you've got there's an alternate recommendation for you, and you would go through the same process. What are the pros and cons of the alternate process? What are the and then how do you weigh that value here? And there could be a third option about, and it might be do nothing, just walk away and stay where you are. The other side of the coin here is to go back, and if you do kind of lean towards taking the recommendation or looking at an alternative recommendation, reasons why you would not choose that option. So you'd go back and decide on why you haven't chose that option and how much you value not choosing it. And you would do the same thing with the other options. And you can have more than one person work with you on this. There's option 1, 2, 3. Well, depends on how many options you have. Who's all involved? What do they agree with you, or do they disagree? If you're the primary decision maker, you are the person that's key in this. And on this side of the page, it's a two-sided page. It just talks about the knowledge level. Maybe you don't have enough knowledge to make a decision, to look at all the options. So you have to go back to the physician that's making the recommendation, or the therapist, whoever you're working with, and find out more information so that you can add this to your option list. And what have you valued? Where's your value list? There's a checkoff here for values. And then what kind of supports do you need? Again, more checkoffs for you to help you make a final decision. And how certain are you? And is there something other that we've missed? So this is a complex guide, but it looks complex, but it's very straightforward, but it takes time to work it through. And as a coach, that's what I do with the families or the patients who are referred to me. I work through their recommendations using this tool. Next slide. Because throughout this process, you have decisional conflicts. You have uncertainty about what option to choose because of the risk, because of the loss, maybe regret, challenge to your personal life, values. Yes, no, yes, no. Next slide. And you click on this, Fiona, as well, for the language. There's tough decisions when there's multiple options, including no change. The outcomes are risky. The benefits and harms that patients value are different. You anticipate regret. These are all kinds of things that you have to balance. Go back, Fiona. That you have to balance when you're making a tough decision. Okay, the next slide. So why does this matter? Healthcare decisions are complex. You all know that I'm sure that's why you're here this evening learning more. There's a high uncertainty because outcomes are not always guaranteed. It can be invasive, and they have risk considerations, and patient values play a major role. So the current challenge is the information is heavy. You're having heavy discussions, and seems to be limited time to explore what matters most. So good decisions equals clinical evidence plus family values. So it's important to understand that healthcare professionals do a great job at explaining procedures, but less consistently supporting how families make the decision. Next slide. So what is decision coaching? As I was talking about the tools that I use, it is a structured, decision coaching is a structured support. I provide before or after, I can provide consults by remote, in person, before or after consults. I help families understand their options clearly. I clarify the values and your preferences, and I help you prepare questions when you go back to your healthcare provider, especially if you're not choosing something they've recommended. It is not about giving advice. I don't do that. I don't make your decisions. And it's not about replacing clinicians. The coach makes clinical conversations more effective. It bridges the gap between the information you've been given and your decision readiness. Next slide. This is how it works. There's an introduction where I'm introduced to you. We talk about your options. We talk about your preferences. We talk about what we get to your preferred decision and prepare you to talk with your physician about your final decision. Next slide. I just have this slide in because I thought it might be of interest to you. There's lots of research done on many of the points I've talked about, but it is about making healthcare decisions. And Cochrane, who did is a trusted evidence organization who runs a lot of research on various components of healthcare and aids that we use. This was done in November of 21 on decision coaching, and the outcome was that there were 28 random controlled trials with 5,509 participants. 17 of those trial decisions coaching with evidence-based info, they found 17 trials out of the 28 improved knowledge, helped the patient improve to make health care decisions, and there were no adverse effects. None of the random control trials measured any quality of decision coaching or observer reported, but it did show that there was an improvement in knowledge and help prepare to make healthcare decisions with no adverse effects. So next slide, please. So what are decision aids? I'm sorry we can't have a conversation back and forth. I would ask you if you know what decision aids are, but they are very well-researched tools. They help you understand the potential benefits and risks of the option that you choose. What's the percentage? What's the value? What's the side effects? It helps you to make more informed value-based choices if you know what the research has said. It prepares you for meaningful discussions with your healthcare provider. It empowers you through clear, accessible information to make confident healthcare choices. It builds confidence for active participation in healthcare decisions. And together with the decision coaches and decision aids, they create a strong foundation for collaborative care planning. And there's quite a few research decision aids on the Ottawa, if you Google Ottawa shared decision making decision aids from the Ottawa site, you will see a ton of decision aids for adults there. There's not as many for pediatrics, but there's quite a few for adults. Okay, I'll go to the next slide. And so the interventions on decision aids that I encourage families to answer or patients to ask their physician, and that we talk about in our discussion is, what are your options? Like if you're being given a suggestion for a change in medication or a change in therapy or something different to try, what are the options? What are the benefits and harms of those options you need to ask? And how likely are those benefits and options of each option to occur? So, when they did a study on that, we found that 87% asked one or more of these questions to make a decision. 43% asked all three, and improved information was given by physicians based on that. And also more physicians started to involve their patients. So these are three simple questions. What are my options? What are the possible benefits and harms? And then how likely are the benefits and harms going to occur? Then you see the tool again that I've already discussed. The next slide. So some takeaway messages here is patients have unmet decisional needs, and health professionals can enhance shared decision making by using decision support interventions. So, activating the patients by using the ask question prompt intervention, using patient decision aids, and adopt the Ottawa Personal Decision Guides. Um, they're in 15 different languages. So if you have a language that you don't speak English, or people who may not that speak English as a second language, there may be a decision guide there that's in a language that's appropriate for you. The next slide, please. So a typical experience is when you're faced with information or you're meeting with a new physician or your same physician who's got a new thought for you, a new therapy, a new recommendation. The typical experience is a large amount of complex information you're given. Sometimes you feel very overwhelmed. You're unclear on what matters most. And together with shared decision making and the coaching, this is where small changes in approach can have a big impact. The consult that I do is focused, it's relevant discussion after families feel more confident, less decisional conflict. The key message is we're talking about the same facts. We just have different decisional quality here. This is where small changes in approach to the medical team have big impact. Next slide. So, what does this look like in practice? It's about simple language shifts. There's a decision to be made here. What matters most to you in this situation? What concerns you most about each option? Support tools, the decision guide and decision aids, the question prompt list, values clarification, decision coaching if preferred, if available and preferred. I always make sure that if your physician is recommending, suggesting that would a decision coach help you with your decisional situation, you have to agree to it. I don't just go, I'm not referred to a family without them agreeing to have a decision coach. These are small, realistic changes. They're not major workflow redesign. Okay, next slide. Shared decision making is important, and I think you probably know this. It's a right. It's still not routine care. You don't see it routinely be happening. It's a recognized ethical standard and a patient right, and it's still not implemented consistently at scale throughout Canada. Really, patients are increasingly open to participate, and the increased diversity challenges is important to pay attention to because one size does not fit all. The challenges in terms of equity, in terms of background, who you are, your diversity. It's a challenge to make sure that the healthcare system doesn't think that just because this fits one person, it fits all, because it doesn't. Next slide, please. These are our partners. I just thought might be of interest to you. I don't know if any of you are from Ontario or if you're all from Vancouver or throughout different provinces. We work with the hospital, for the Ottawa Hospital, Ottawa Research Institute, muscular dystrophy, Sick Kids, University of Toronto, IDEA Learning Disabilities, that's an association in London, the London Family Court Clinic, of course, Children's Hospital, and Western University. These are all our existing partners. Go to the next slide. I think I'm close to the end. And so this is a time for discussion questions. So I've highlighted what shared decision making is. I looked at discussed the tools with you. It's a conversation. It's a flow of information back and forth. It's working with a decision coach, if you wish, clarifying your decisions, using the tools that are available, the decision aids, having private conversations with a decision coach. Referrals for a decision coach for myself is very easy. You do not need a physician to refer you. You can self-refer. I do referrals from all over Canada, primarily, of course, in Ontario. but I have done referrals from outside of Ontario as well. And that's kind of how it works and what it is. So I'm open for discussion and chat so that we don't use up all the time with slides.
Great, thanks, Bonnie. I'll just unmute the attendees and then anybody wants to ask a question out loud, uh, they can. Um, While they're thinking about that, I'll just mention that AMAC has some prompt lists, question prompt lists that may be similar
Yes,
to what you mentioned.
yes.
They're on our website for those of you who aren't aware, and there's one for each of the three diseases we cover, and they have a long list of questions you might want to have with you when you visit your doctor. Many of them are centered around the first diagnosis, but there's probably questions in there that are valid as you're going through treatment as well. Can you say a bit more, Bonnie, about how people might access this kind of support in other provinces? I mean, I heard you say you're available, but I'm sure you can't cover all of the patients across Canada who might like this kind of support. Is it available in some other provinces or through other hospitals?
Unfortunately, it's not. We're the only clinical program like this across Canada, and that's what we're known for. We're trying to, I think other organizations have tried to set it up. I do webinars with the teams to try to talk a little bit about our experience and how we got started and what they could do. But that's partly why the Impact Award came along, is because we're so broadly known now. But there's not very much going on. I think the pediatric area does a pretty good job. The adult world, I think that some organizations practice shared decision making, but there isn't a coach. Someone probably on the team tries to act out, take that role on, depending on their capacity, because they probably don't have the capacity to sit down with the family or the patient for an hour and have a private conversation and work through their decisional issues. And that's the beauty of a decision coach. But we're the
Mhm.
only one that we know of across Canada.
But the methodology itself is becoming a bit more well known with the healthcare professionals.
Well, we're trying to. There's lots of literature, a lot more on adults than there is on peds.
Mm. Hmm.
Lots on adult,
Okay.
and through the Ottawa site, there's lots of information on the Ottawa site. We do work with them very closely. Our decision aids and our tools that we use are based on what they have validated, the tools that they recommend. But our
Uh,
program is designed here, and I have recently transitioned a bit into the adult side, mainly oncology, and we've
mm,
done some studies around just decision coaching for the oncology patient. So we're hoping that it catches on a little more on the LHSC side of things, so that the adults, it might be made available to them. But I do most of the outside of children's or LHSC. I do adult through Toronto, through Quebec, Montreal, Theo, Ottawa. Those are places that occasionally refer. But they do have programs and people that are supportive of the methodology, but they don't have a system like we have. Um, because I'm also outside the circle of care. So I come to the family's objective. I don't sit in on your consults with your physicians in the clinic. I'm not biased. I come, uh, you know, in a, I come in an unstructured manner with no biases, so that the families do not feel that I've already understood and made a decision. I'm not the expert in the recommendation, but I do have to understand the recommendation, and I have to get the decision tools prepared for the family so that they understand, because sometimes the teams don't take the time to show you the strengths and weaknesses and the decisionals um, some of the decision aids on the recommendation they're making. So you don't know what's in favor, how many were, what percentage was in favor of that particular recommendation, what are the harms, what risks you have. So that's my job as a coach to make sure that I have that and give that to the families.
I have some more questions, but I'll check first whether anybody else on the line wants to ask a question. Okay, I'll jump in. So I'm sure you've come across cases where, there's a family member who maybe has a strong opinion about a treatment option, and maybe is, pressuring the patient to accept that option. How do you deal with those situations?
That's where you, if they can't make a decision, that's where the team has to say, on our resources, we have decision coach. Would you like to speak to a decision coach? And if they agree, then the referral comes to me, and then I contact the family about who I am and how what the process is, and we set up a time that we can discuss it remotely. If they live in London and want it, like if they live here or they're coming here, we can do it face to face. But most of them are remote because people can't travel that far. And then we go through the process of seeing talking about using that decision guide that I went through. Making sure that we understand what the decisional issue is, and taking them through that, looking at dissecting the options that they have, and the option that's been recommended. There might be a different option that the physician might have recommended two options, and
Mhm.
they have to choose between the two. So we have to look at the pros and cons and the risks and benefits of both. And then what about the values? The values are very key. How does that fit in their life right now? Does that seem like it's going to be what they want, that would work for them? And then at the end, it's a preferred decision because I don't make final decisions. But once it's a preferred decision, I do a consult that goes to the physician, and then the family, the person the individual who's come to a preferred decision makes their final decision when they meet with the physician.
And do you find that when the family's involved in that, they're more, I guess they can see the perspective of the patient more by the end of the process?
Who, the patient sees that or the team? I'm
The
sorry, I didn't.
if there's a family member with a strong view on what
Oh,
option the
a family
patient.
member of strong view. That's an interesting one because sometimes they do um, the primary decision maker invites a family member with them, whether it's a spouse or a parent or someone else that they're close to who has a difference of opinion. But it's the primary decision maker that I focus in on, and
Mm,
and the person who's there is still valued. They they would be doing the same thing that I do with the patient. I'd be saying, let's talk about your uh, what your risks and benefits of this are, so that the patient could actually hear, they could discuss it together, and each could hear each other's viewpoint. Lots of
mm,
times that
mm,
comes up where you think you're talking with your friends or people that are engaged with you, but when you get into a concentrated discussion and you talk about the options and the risks and benefits, and you each hear each other and you discuss what each other's heard, because sometimes you learn things from others that you think, oh, I didn't think about that, I forgot about that, that's a good point. And sometimes that really is very helpful, but it would be the primary decision maker who comes that would make the final decision.
mhm, mhm.
And that often happens, right? They can't make a decision because they're getting information from all sources and recommendations, but you have to bring those people together so that they can all be heard and they can talk about their pros and cons and the risks and benefits, because we do learn from each other on things we hadn't thought about. Because maybe that friend will say, well, you can't do that, you may have trouble with that one because this is what I've heard you say, or this is what I've heard you do, and the person will say, "Oh yeah, I forgot about that."
Yeah.
You know, yeah.
Yeah, I'm sure that's such a valuable process when there's a
Very,
bit of conflict going on. Yeah.
yeah, very.
And what about follow-up? Once the decision's been made, do you have any role in checking in with the person to see if they're happy with the decision and how things are going?
No, I don't carry the patient load and I don't go back and follow up unless they want to talk to me again. It's up to
Okay.
them. I leave it in their hands. There's no pressure here. There's no force. I don't make any decisions. I just say to them, if should you want to discuss anything further, another decisional conflict or something arises out of your discussion with your physician, you have my name and my number. Please make contact with me again.
Okay. Yeah.
We have quiet people, I guess, maybe.
Um, with regards to that decision guide that you showed, I mean, maybe I could jump back to it in the slideshow.
Sure.
Um, is that something, oops, no, didn't want to do that.
Oh, you just ended the slideshow. You can always bring it back up, I guess.
Let me find that. Uh,
Yeah, keep going.
that one. Yes. Mm.
Yeah, that's it. That's one of them. Yes, I've got that one as an example. That's
So,
a personal one.
can people, download this tool and
Yes,
use it themselves if,
yes. It's also on our website. You can go to our website and get it and download it, or you can go to Ottawa. Just Google Shared Decision Making Ottawa University or Don Stacy right here, and it should come up, and you would get the guide. You get it in different languages, whatever language you want.
okay. And are there any special tips you would have for people using it on their own?
No, I just they'd have to just understand how to use it to make it valuable, right?
Mm-hmm.
And it explains everything here and what it is and
Oops,
what you
sorry.
need.
Sorry. Went there.
And certainly on the website, I think it's the same. So yeah. It's
Okay.
well written out here to say, make sure that you have enough information, you have support. You may not want support. Uh, you have values. It's all laid out there.
Okay, great. Yes, we do have an article on this topic coming up in our next newsletter, and I think we've included there a link to the Ottawa site where they have a lot of the tools you've mentioned.
If you don't and you miss it, just Fiona, send me back an email and I'll send you the link.
Okay, great.
There it is again. So yeah, yeah, you got it.
All right. I don't think we have any other questions then. Anybody?
We
No?
lost one person. We just got one.
Yeah. Okay, I think we're good then. Thanks
All
so
right.
much for taking the time to share that information with us. And
Oh, my pleasure. Stay in touch, Fiona, if you ever need anything.
okay, and yeah, I'll just let people know as well. If you're okay with it, Bonnie, we'll also post your slideshow on our website.
Sure,
Is that all right?
absolutely. Yes,
And then if people want to get your email, they can see it in the slideshow there, right?
yes. At the very end, there's the code there to
Okay.
get into it. I'm happy to talk to anybody if they wanted to have a talk, by calling me or sending me a message. We can arrange a discussion. I'm happy to do that.
Okay. Great. Thank you
Thank you
so
for reaching
much.
out. Okay.
Okay, take care. Thanks everyone. Have a good evening.